The Earth's population is 7 billion people, and they all need water to survive. 97% of the water on Earth is salt water. 2% is glacier ice. 1% is fresh water. Our environmental footprint, population growth, sanitation process is contaminating our water supply.
The World Health Organization listed a framework for safe drinking water requirements. Unfortunately, not all countries are equipped with filtering systems for safe drinking water. For instance, Afghanistan, Ethiopia, Cambodia, Laos, Haiti, India, and Bangladesh have less than 15% of readily clean water available. Congress formulated a Safe Drinking Water Act and made it a federal law to ensure the quality and safety of drinking water for Americans. The Environmental Protection Agency sets standards to oversee the quality of drinking water and oversees the states, localities, and water suppliers who are required to implement these standards. The main threats to drinking water are animal waste, pesticides, wasted injected deep underground, human waste, improperly disposed of chemicals, and naturally occurring substances that can all pollute drinking water. The major pollutants in the nation's water include mercury, bacteria, nutrients such as phosphorus and nitrogen, and low levels of dissolved oxygen, which is caused by the decomposition of organic material. The major causes of pollution in the nation's waters include agricultural runoff, air deposition, and hydrologic modifications, which is the water diversions and channelizations of streams. Dead zones are hypoxic, low-oxygen areas in the world's oceans and large lakes caused by excessive nutrient pollution from human activities coupled with other factors that deplete the oxygen required to support most marine life in bottom and near bottom waters. Scientists have identified 415 dead zones worldwide. Not all dead zones are caused by pollution. The largest dead zone in the world, which is located in the lower portion of the Black Sea, occurs naturally. Dead zones occur in many areas of the country, particularly along the East Coast, the Gulf of Mexico, and the Great Lakes. But there is no part of the country or the world that is immune. The second largest dead zone in the world is located in the United States in the northern Gulf of Mexico. Sometimes we can observe the factors leading to a dead zone or the consequences such as a fish kill. However, dead zones are actually invisible.
The ability to access safe drinking water after a natural disaster can be challenging, thereby opening the door for the contraction of a number of water-related communicable diseases by disaster victims. The World Health Organization reports 3.4 million people die each year from water-related communicable diseases. In the wake of natural disasters, rivers, lakes, and oceans are at risk of becoming polluted with organic and inorganic chemical compounds such as heavy metals or cyanobacteria known as algal blooms, which are toxic to marine life and to the humans who may consume them.
Our Earth is hurting, with many areas being affected by our lifestyles. The ocean is a landfill of plastic containers. In the Pacific Ocean, there is a trash vortex of plastic the size of Texas. Some of these long-lasting plastics end up in our stomachs of marine birds and animals, and their young. The plastic particles end up being eaten by fish, which is consumed by humans. Another human activity that affects marine life is oil spills, which takes years for the environment and wildlife to recover from. Cleanup and recovery may take weeks, months, or even years to clean up. More than 3.4 million people die each year from water, sanitation, and hygiene-related causes. Nearly all deaths, 99%, occur in the developing world. In developing countries, 70% of industrial waste is dumped untreated into water, polluting the usable water supply. Pollution is mainly caused by industry, agriculture, and sewage, but the most common contaminant of drinking water is fecal matter. The impact of this is dramatic. According to UN statistics, every 20 seconds, a child dies as a result of poor sanitation.
Dirty water is the world's biggest health risk and continues to threaten both quality of life and public health in the United States. When water from rain and melting snow runs off roofs and roads into our rivers, it picks up toxic chemicals, dirt, trash, and disease-carrying organisms along the way. This can lead to drinking water contamination, habitat degradation, and beach closures. According to its recent UN study, more people on Earth have access to cell phones than toilets. Out of the world's estimated 7 billion people, 6 billion have access to mobile phones. Far fewer, only 4.5 billion, have access to working toilets. Of the 2.5 billion who don't have proper sanitation, 1.1 billion defecate in the open, according to the study. The good news is the UN is trying to cut in half the number of people without access to clean toilets by 2015 and eliminate by 2025 the practice of open defecation.
With the new laws from Environmental Protection Agency and world projects that help educate people on proper sanitation and proper food handling, we are making strides to improve health of people. With dedicated people, we can start to see a change. Together, we can help protect our environment, health, economic well-being, community, and quality of life.